It is time for our Monday Motivations, brought to you by Gates Brain Health, and we are so lucky to have a timely topic for you today with Dr. Randall Gates, board-certified chiropractic neurologist and chiropractic physician, because we are talking about Lyme disease. A lot of people, you guys know, Lyme disease comes from ticks found in Lake Tahoe, Northern California and stuff, where a lot of people are going for the 4th of July.
Absolutely, yeah. And so Nevada, per se, by most experts' opinion, is not a Lyme endemic area. But most of us are going to Northern California, the foothills of Northern California, where the Pacific black-legged tick, I believe, is endemic, that carries Lyme disease.
So if you do get a tick, what are some of the things that you need to know?
Great question. So if you get a tick, I would go to the doctor immediately, urgent care. You can actually do microbiology examinations of the tick to see if it carries Lyme disease or the bacteria that causes it, Borrelia burgdorferi. And that's a really, really important factor for everybody to know.
Now, I know that when ticks kind of bite into you, they start to burrow into the skin, right? So a lot of the times people will be like, oh, I found a tick, and they pull it off real fast and then they're done. Does the tick have to be on your skin for a certain amount of time to kind of risk that increase of Lyme disease?
So most experts consider that it needs to be on there for 24 hours.
Okay.
Another consideration is that larval or nymph ticks, the small ticks, the baby ticks, actually pose the highest risk of Lyme disease, at least in this area of the country too.
Okay, so making sure that you are constantly checking if you are going to be in those wooded areas.
Exactly, exactly. Yes. Very, very important.
And then is it possible for, I know we look for them in our pets, like our dogs and stuff. Can dogs get Lyme disease, or do they get some kind of equivalent to that?
I believe they can, but the dogs are not my area. So.
Not your expertise. Because I was just thinking about that. I was like, I have a lot of friends who are constantly pulling ticks off their dogs.
Exactly, exactly. But it is thought that those ticks can then go to us as well.
So fingers crossed, if you do get a tick, catch it immediately. The other thing that you need to do is that if you do get Lyme disease, there are lots of things that you can do to treat it and stuff. Because you talk about in our text conversation about chronic Lyme disease, which sounds awful.
It's awful, and that's really what everybody needs to know about to try and avoid.
Okay.
So if you jump on it early, if you have a summer flu or a flu-like illness and you've been camping out in the woods, I think it's really important to think about Lyme disease as a possibility.
Oh, interesting.
A lot of people are aware of the bullseye rash, which can happen in 40 to 70% of cases. We're actually now realizing that it may not even look like a bullseye, and a lot of people it may present as hives or just a rash. And so, nonetheless, if then a person starts to feel sick about a week after being in the woods, they really need to seek medical treatment. Because if you jump on this early, the chances of developing chronic Lyme disease, there's a number of different terms to it, or post-treatment Lyme disease are much less.
Interesting. So there's different, like, I guess maybe levels of Lyme disease that you can get, because there isn't necessarily a cure, or is there?
Well, basically, if you jump on it in the first 30 days, your chances of not developing the chronic form of it are much less.
Okay.
But even some individuals who jump on it in the first 30 days can develop chronic Lyme disease. They're saying somewhere between 15 to 20%.
Oh, interesting.
Yeah, so it's really important to seek treatment immediately.
Yes, and then your role as a chiropractic neurologist, chiropractic physician, how do you treat chronic Lyme disease differently?
So that's a really good question. So the chronic form is what I work with, and we're finding that it's a chronic inflammatory disease, an autoimmune disease that actually came out around 2015.
Oh, interesting.
Very interesting. And so I work with patients dietarily, through nutrition, through supplementation, and I've actually seen some astounding improvements in some of my patients.
That's great.
Who had been on years of antibiotics and we're not responding otherwise. So it seems to be a chronic inflammatory disorder.
And it goes back to what you talk about a lot about different diseases that you treat, and it really comes back to diet and health and your lifestyle and the things that you can do that may not necessarily be medication based to help alleviate some of your symptoms.
Right, because diet didn't cause Lyme disease, but diet could be the thing, like the fuel under the fire, keeping that inflammation going. So if we can change your foods, change your gut, do we have a better chance to control the chronic inflammation in your body?
Yeah, well, if any of this is resonating with you guys, if you have, if your ears are kind of tingling a little bit, maybe this is something that impacts you, you definitely want to go ahead and reach out to Dr. Gates. All of his contact information is going to be on our website, colotv.com, after the show, along with this interview. So Dr. Gates, as always, thank you so much for being here.
Thanks for having me. Yeah.
And happy 4th of July.
Happy 4th of July.
All right, we'll be right back after this quick break.